amazed. I have no pain in my wrist. I can move my wrist 100 times more flexible than before without pain.
Hello, sir.
Hello.
Nice to meet you.
Nice to
My
meet
name
you.
is Irina.
This is Serena. You're the one.
Irina.
Irina. Okay.
Yes.
So, and the gentleman's name is.
Dr. Mikkel,
Oh, okay.
founder and inventor of ANF Therapy. Yes.
Honey, we have the inventor here.
Yes.
Of the process.
Yes. And your name is Alan,
Alan.
right?
A-L-A-N.
All right. So Alan, welcome to ANF Clinic.
Thank you.
We are here to help you in any problem that you might come with using the ANF therapy. ANF therapy is an innovative technique, innovative therapy, and maybe you have some questions about that, right?
I have a lot. Wayne explained some. He said something is about wavelengths that treat the body, treat the pain center. I had tried something like this years ago that you put a pad on and it was connected to a little machine and it did like vibrations. It was a pain in the neck to use it. I think it may have helped. I don't know, but I haven't used it in years. And Wayne told me about this, and I have a lot of pain in my wrist and my ankle, some in my right shoulder, and I live with it every day. And so I said, oh, I will try it. But I have a lot of questions. Like he said, you wear it for 3 days.
Yes.
Okay, what happens after that? Is it still the pain, or you have to put another one on? So I figured you'll explain the whole thing. We're going back to the States in 10 days. Do I take some with me? I will be back in December for 5 weeks. So I would assume I could then do a session. So yes, I'm curious, because if it works, I would really be happy.
All right, wonderful. So yes, ANF therapy works with the ANF device that is charged with frequencies. But the good thing is that it's not connected to any machine. It's not portable machine or electromagnetic machine. No, it's a wearable device that contains neurological frequencies. These frequencies will stimulate your nervous system towards healing and pain and inflammation reduction and many other functions. So yes, we apply the devices on the area where we find the injury. Where to find out the root cause of the injury, we need to do a physical examination.
Right.
We will check your wrist, your ankle, and we will find out where are the areas of the inflammation and the injury. Then the devices will be applied on the skin, and they should be on the skin for 72 hours.
Okay.
You can have a normal shower. The devices, the glue is quite strong, so they will.
So it'll be fun taking them off.
Many times the problem is to take them off.
Sure.
Other people, it depends on the skin quality, the skin, if there is any body cream or sweating, then they might follow you for that. Alright, so but we can help you with the glue as well. Alright, so an important thing is that it's a wearable device that is working day and night, but you are not going to feel any electrical impulses. It's very subtle.
Right, Wayne told me. Yeah,
So,
he did tell me that.
So you will feel the benefits immediately, or you will experience detox symptoms. I believe that you have read the patient information and you went through some of the symptoms: a headache, dizziness, dry mouth.
No, I don't have any of those.
No, it's that it might occur when your body starts to heal itself, when your body starts to eliminate the waste product.
Of course, it's like detox, yes.
Exactly, so you might experience those. It could be today, now with us here, it could be this afternoon, or it could be in 2 or 3 days, we do not know. Just be aware that if you start feeling some headache, dizziness, dry mouth, fatigue, discomfort, drink more water and rest. That's the only thing you have to do, all right?
Well, Wayne didn't have any of those, so
we hope it's the same with you. There are some people that are lucky and they go through detox without feeling that they are able to get rid of all the inflammation without experiencing the detox.
Well, the doctor I saw several months ago, actually, we did blood tests, and he said, I have a lot of inflammation, so anything that I can do to get rid of it will be very helpful. Try to cut out sugar and bread from my diet. Of course, arriving here, the food's so good, but yeah, I'm doing a lot to get rid of inflammation. So I have been feeling symptoms from even that when I stopped eating bread and sugar for 3 weeks. I felt it. So, okay, I'll look out for it.
All right, okay. So then you were asking, you were here for 10 days.
10 more days, yes. We've been here 2 weeks and a half.
All right, because the treatment consists of changing the devices until the tissue has healed and that until the tissue is strong again. It's not only until pain goes away, we make sure that the tissue is as strong as possible before you're discharged. But for that we can talk, because we have 10 days, we can do a lot in 10 days, but also we can send you home with some changes that you can change while you're in the US. Also, we have therapists, we have ANF Therapists there.
I heard, yes.
Yes, so you can visit one of those with our protocol, and we can contact these therapists there so they can follow our guidance as well.
Because Wayne said one of his friends is a Canadian and comes every 2 months to do it here. Karate man or something with a knee problem. He said when he goes, he takes them with him. So.
Yes, exactly, yes.
Great. And so after the 3 days, you take them off and then you put new ones on?
Yes.
Okay.
So after, you can at home, before coming here, you can take them off, all of them, throw them to the garbage, you have a normal shower, and then come here with the skin, with the clean skin. So that's the best thing for the device, right? But normally you can have normal shower, normal life, and that's all.
So I hear you had a problem with your wrist.
Yes, an accident from 1971 in Cartagena, Spain. Never did anything about it. 6 years ago, I started having trouble. I went to a doctor. He gave me injections of, what's it called? Right, yes. It helped the first few, every 6 months. It helped, and then it stopped. Then he did a surgery to cut the nerves that send the pain, because it's the operation, he said, it was having success in Israel, and it didn't work. And the next one is to take the bones out because they're so bad. And,
so you have pain all the time?
as I explained, mostly when I stop at night, and I think, and then I realize, and if I put my hand, like now it hurts. If I do that, it hurts. But at night, it hurts just lying in bed. If I put my...
That's because of the healing process.
The ankle was an accident I had maybe 10 years ago. I stepped wrong in the street and broke a tendon, ruptured a tendon, and he fixed it, and it just never fixed
Never
it.
got better.
No.
So you're Wayne's father?
Yes.
Ah, okay. So here's the story about his neck.
Yes.
So
Yes.
he's happy, yeah?
Yeah, he's amazed. He's feeling good.
Okay, what movements can you do with your hand that do not hurt?
Well, this doesn't hurt. But if I do that, yes, it hurts. If I try to do that, it hurts. If I try to put pressure on it like that, it hurts. And in bed, if I lie the wrong way, I don't know how to, like now I'm not feeling it, but if I lie in bed with my head on the pillow and I put my wrist the wrong way, I have to move it until I find where it doesn't hurt.
Okay. It's okay. What I will do, I will check you after the nerve system. Means that it will probably hurt.
Yeah.
Yeah. But the nerve system never lies, because this is all about to find where the pain comes from. Even if you had a fracture, whatever, on the ankle, wrist, it can also be something else that's actually creating the pain because you're moving it. Okay. So can you take this one off?
Yes. Joyce, honey. This was prescribed by a doctor, and Joyce booked her from him to watch my heart, which...
Yeah. Okay. Check this in first. Okay. So
Yep.
Okay. So I will first check the ligament here, and I will go in between like this. So actually, the way I was taught many years ago, that we can feel anything with our hands if we know what to feel for, where an MRI or CAT scan cannot see.
Yeah.
So here we okay. So we have some damage on the ligament here. I'm gonna bend it, that's a relaxer. So this is the...
Yep. Ow! Oh!
Yeah, okay.
Yeah.
This is better, right?
Yeah, that's not as bad. I feel it, but nothing like the other one.
No. Turn your hand around, please. You never had numbness in your fingers? The fingers is for fine?
Yeah, no numbness that I can ever remember. Oh, ow, yeah.
Okay. So I will decompress. I will pull it apart a little bit.
Okay.
Is this okay?
Yeah, I do that sometimes too to relieve it. Yeah, that bending is what hurts.
Yeah. This is okay.
This is okay. It definitely comes around here sometimes.
Yeah. Now you have the injuries right here.
Yeah.
So you have also here the ligament, and you have the tendons and nerves that goes over to your fingers. So
It's a funny story how the accident happened, but I won't bore you with it now.
no worries. You can tell it. It's nothing.
It's very... Oh, ow, yeah.
Okay. How's this?
That's okay.
And this?
It's okay. It was only when you press like that I feel.
I'm checking the joint here. Okay. I'll follow up here. No pain in the elbow?
No.
Nothing. Okay.
Nothing up there.
So I'm going to go in between all the nerves here. to the joint.
Yeah, there I feel it. Yeah.
Turn around again. So I go in between here. So I go in between all this tendon here,
No problem.
and then I go in between here.
There, oh yeah. Yeah.
It's nice, huh?
Yeah. Yes, definitely.
Definitely very nice.
And not so much there, but a little.
Okay, so I'm gonna go here. I'm gonna block one nerve here. You feel this here?
I feel it, but yeah, I feel it. There I feel it.
Yeah. And we're gonna bend you over wrist. Pain worse or less?
Worse. Yeah, it's hard to bend.
Yeah. I'm gonna do the same with another nerve here.
Ow. Yeah. Ow. Not as much pain there though.
See, right?
Yeah. Less pain. Oh, now it's.
So you just tell your wife to push here, right?
Yeah.
Okay.
I'll mark it.
So that means the radial nerve is that is mostly effective. Okay, let's see what we can do. So we can start with 200 minus 9, EGL, ACA, and let's do that to start with. This may be easier than you think.
So bless you every day.
No, what happened here is when you have the fracture, you have a very chronic inflammation.
He told me.
And what happened is that the tendons and everything that pass through and the ligament here is damaged. So they have been like this. So every time you have moved, you have irritated. So probably develop what's called a little bit of spurs in between the joint. That's small bone fibers that's irritating it, eh? Okay, so I will apply this here. Actually, it got better here. It's not so painful.
No, it's not so painful. When you got there, no, a little bit low. I think it was right
there.
No,
maybe here.
No, there's a little more.
No, I just kidding. No. Okay, so it's.
Yeah, there it's ow, ooh, ow.
Just gonna put this here. So I'm using a very, very low frequency here now. Can I get -9, please? Oh, I'm gonna put it here. So like this. And ACA again, please. You can see already now the swollenness is going down.
Yeah, hadn't realized how swollen it was until I just looked at it.
Yeah. We're gonna have that one here. Are you ready for this?
For what?
We will see.
Okay.
Okay, bend your hand.
Not as painful at all. I can bend it more.
Yeah, see? Then you put it here and put full weight on it.
Yeah, I still feel it, but less, much less.
Wow, in seconds.
Yeah.
So how many treatments did you do before to fix this?
3 shots, and then the operation over what, 5 years? The last 5 years, and it never got better. Well, the first shot helped, I think, for a while, but
The cortisone is like, the cortisone is actually the only more or less anti-inflammatory they can use. If they hit 100% correct, it can help. But in this case, it's so many because you fractured it.
I know the bones are all messed up in there. But
if you bend it now,
nothing, no pain. No pain. Magic.
it's cooler.
No pain.
You should just have come here in 1970. Oh.
They didn't even have x-ray machines in Cartagena. Oh my God, no pain. And this is where it sometimes gets worse. It travels around, and I don't understand because nothing. Can I kiss him?
No, but this is very important because the nervous system controls everything in our body. We can check your heart, your liver, your intestines, everything. But if the neurological oscillation is weakened or damaged, and then the body's immune system immediately create inflammatory state.
Yes.
And that will, by time, get chronic. Because in the beginning, inflammation is protective, but during time, it's getting a problem for us. So what this device is doing is sending in a correction signal to your nervous system and repairing this oscillation here, and actually tell the nervous system, Houston, here's the problem. You need to put resources here and fix this. So all these devices is differently and do different things. And that's why the inflammation goes in seconds. This is how fast our immune system works when it's working perfectly. This is why we never get sick when we are kids. It's very rare. And the older we get more and more problems.
Yeah.
Because our resources getting less, right? So This will work for 72 hours, and you need to drink water.
Yes.
Because the more hydrated you are, the faster and the better it works, okay? And then they need to be changed after 3 days. But now I just use the weakest one. So if you just relax now, I will just try to do, keep your arms straight.
I feel a little strain, but not pain.
No, because you haven't done this in years, huh?
Right, I haven't been able to bend it. And that's why I don't want the operation, because then I won't be able to bend it hardly at all.
No.
No, I couldn't do this yesterday.
It's weird, huh?
What?
It's weird.
It's magic. No, I couldn't do this yesterday. Boy, am I glad Wayne sent me the link.
Everything happens for a reason.
Of course, that I do know. And I'm tired of trying all the things I've been trying to get rid of the pain.
But you live here in Spain now, or where do you?
No, we visit 2 or 3 times a year for 4 or 5 weeks each time to see Wayne and our grandchildren.
Yeah. So you're still living in the States?
Yeah, we live in the States most of the time. We have 5 grandchildren there, and we have 3 here. So
Yeah. But it's a good way to travel. It's a good reason.
I've been doing that since 1969. I first came to Spain.
Cool. Yeah. I think
So-
many Americans is jealous. They want to come here, but they never do. Because your country is so big, so they travel mostly inside the country. Right?
Or they go to Italy, because
Yeah.
they know Italy.
Yeah.
But
So let's check your ankle as well.
okay, you want me to take my shoe off?
Yes, please. Okay, yeah, I can see. You put the leg up here. Oh man, they made a quite bad reconstruction here. Yeah. Okay, so I will check these two.
Yeah.
Enjoy the ride.
Thank you. Ow. Yes, ow. 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 No.
This was fine.
Yep, that's okay. The tendon that broke was on this side,
Yeah, I see.
Yeah.
Because he also reconstructed the whole joint
And-
without getting arthritis in it.
and he moved my heel over.
Yeah.
My heel at this
Yeah,
place.
yeah.
He didn't tell me that.
Which year was this?
Do you remember the year? I can look it up, but it's about. Oh, ouch, ouch, ouch. Yes, ouch. No, that's not so much. It's right where the plate was. The plate got infected and they had to take it out before I did my shoulder. That was about 4 years ago. So the operation was probably
So
five
they
and a
put
half.
the metal plate here in the joint.
When he moved,
Yeah.
the heel was like this, and he said he moved it
Yeah.
like that, but he put a plate in, and he said he might have to take it out, and it was giving me trouble, and I had to have my shoulder replacement, so I had to postpone this because they had to take the plate out because it was infected.
I think he used you as a lab rat. The way I can see this, I see many constructions of ankles because today you have a prosthesis you can get, but it's still a very complicated surgery. But this is the really old way when you have a fracture.
It wasn't a fracture; it was a torn tendon.
Yeah.
I don't remember the
So
name
it was
of it.
only the tendon that was torn.
He said only the tendon was
And he
ruptured.
did all this.
And he moved a tendon over to a tendon that he said I don't use as much. He moved that over, but without telling me. What did he tell me the day
I
before?
told you the morning you
The
walked
morning
in
I was
for the
going in, he-
surgery that he was going to move your
He said
heel.
your heel has done this, and he was going to move it back, and he had to put a metal plate in.
Yeah. So he really badly. Yeah.
That's what I feel.
I could use a bad word now, but I will.
Well, I mean, I have been thinking about going.
No, but I mean, for a tendon rupture, first of all, you never do these kind of reconstructions, and you never do this because actually your whole ankle is moved because of it. Okay.
Ouch.
Yeah.
Yep. Ouch.
So
Ow.
yeah.
Ow. Ow. Not so ow.
Not so.
Ow. No.
Yeah, you can have a small chipito tonight with this. Okay, I just take 200 man stand here too, just to give him.
And I'm a dancer, and I really miss
Yeah.
dancing with my wife.
Let's see if we can make it dance again.
Well, I can dance for a little. We danced I had a party on the 6th of May for my birthday, and Joyce and I got to dance. I can dance a little, but I can't dance a long time. But I think it's mostly because I'm out of shape. But the ankle does start hurting.
Okay. Space here. Am I allowed to sing in this?
Absolutely. You were allowed to do anything. Within reason, of course. Out. Yeah. No. Out.
Okay. Adrian, listening. This is fine here.
Yeah. No real pain. I mean, I can feel what you're doing, but it doesn't hurt like the other places. I feel stress on the other side.
But no pain here now?
No pain, no. No pain. No pain.
And this
No
now?
pain. No pain.
Magic.
No pain.
I said.
No pain.
Okay, walk on it to see how it feels.
When I do that, just when I come up, I feel it about here. I can't bend down and. No. Can we come over here? No, no pain. One thing, let me try, because when I notice the pain at night is when I'm lying down.
That's
And I
called
do this. If I do this, it hurts on the left side. It's not hurting now. If I do this, no pain. Joy, no pain.
I'm gonna put.
I'm always in pain if I do this at night. I can't cross my legs this way. I can't cross them this way. Now I can. Absolutely nothing. Wow.
Any seconds. I'm gonna put two more under your foot here to support. So, just to shoot it right up. Because of the surgery, you become quite flat-footed.
I always was.
You was before?
Doctor, my feet were like this. They were like this. You know, most people are like this. Mine was the reverse. I'm very, very bad flat-footed. I have plantar, I can't pronounce it.
Plantar fasciitis.
That's it.
Okay. So I put this is just to shoot the frequency also through the joint. So, okay. No, because normally with these I can feel some screws here and stuff. If I did like this before, you will probably scream because
Yeah.
I impinge everything. But now I can give you full force.
Yes, it's
Well, that's the first time in about 5 years I haven't had pain.
It's cool. Now you know where I am.
Yep.
No.
Now I understand why Wayne's Canadian friend comes back every 2 months to see you.
Yeah.
That's
May I ask a question?
yes.
Sure.
Because he's had this operation, can this be a healing as well as a pain reduction?
Yeah, this is what we do. This protocol is anti-inflammatory, but also use the device for antioxidants that repair skeletal cells and remove free radicals that are creating the problem. So when that is gone, the body actually can heal itself. It doesn't mean, it cannot reverse the surgery, but if you do some mobilization and moving the ankle as much as possible, same with the wrist, and get it like movable, then of course it will get a lot better. Because the body will adapt as soon as no pain. Because when you start limping or doing anything, it's a compensation from the nerves that say, hey, here's an injury, don't use that side, use this side. But when it's not there, and now comes important information, you will be pain-free. Means you're gonna move as you never moved before in many years. You're gonna do things that you never done in a long time. Means a lot of muscles have not been used properly. So you will get a secondary pain that will feel differently, but that is training pain.
I understand that.
Because when you walk like this for a long time and all of a sudden you walk straight,
Yeah.
it's a lot of muscles that's too short or too long, right? And now they get
Equal.
Yeah.
So you're saying the same thing the doctor told me in 1971. You'll compensate, it'll be okay.
Yeah,
but now it really will
Yeah.
be okay.
I would probably say the same at that time, but now it's very important. As long as you don't have pain, use it and as much as possible increase the mobility.
Yep,
Okay?
yep.
But without overdo it. If you start to feel pain, drink more water and the pain will go away again. But after 72 hours, of course, these need to be changed.
Yes.
Okay.
So I have to come back in 3 days and change it.
If you want, we can give you some changes you can buy from us, or you can change at home because it's quite easy to apply them.
But you use different frequencies in it. So
Yeah. But we do
a chart.
Yeah. So if you're here in Marbella, then you can come back on Monday and we can look at it again.
I have a dental appointment Monday at 10 o'clock to put you see, the last missing tooth.
That I cannot do. I can do it.
I can hide it,
Yeah.
but I can come Monday afternoon, yes.
Yeah, sure. Because
Yeah,
then
I
we
would
can-
love to while I'm here, and then I'll learn more how to do it when I'm home.
Yeah.
And then I will find someone in the States, as
Yeah.
you said, and we're back here in December and January.
Yeah.
So
It's just to keep this so it doesn't come back.
I
Because the
understand.
problem with the feet is always that we use them all the time, so they never get real rest. But with this on, you will probably feel like you will dance like a king tonight for sure. Do the rumba and salsa and the 60s, throw the wife up in the roof.
we dance a lot.
Yeah.
We dance a lot.
Okay, tell us what brought you here today to the ANF clinic.
Well, what brought me is that my son had done this, and he knows I have pain in several places of my body, and he told me how wonderful it was, so I thought I would come and try it, and I'm very glad I did.
What type of pain? Can you describe?
I have very bad pain in a wrist injury that happened almost 50 years ago, and an ankle injury that happened about 10 years ago.
Okay, and could you rate your pain before you came on a scale 1 to 10?
At certain times, it certainly was a 10. At nighttime, it would be between 7 and 9 if I moved my wrist wrong or my ankle wrong. And during the day, it was less noticeable unless I was walking, and then, of course, my ankle would hurt. But my wrist didn't hurt so much in the day because I was busy not thinking about it. But as soon as I stopped for the evening and thought about it, I felt the pain.
And can you describe how do you feel now?
Amazed. I have no pain in my wrist. I can move my wrist 100 times more flexible than before without pain.
After how many years?
Pardon?
After how many years?
The wrist started really hurting about 7 years ago, but the accident was in 1971, which is 52 years ago. And I just compensated with other muscles. But about 7 or 8 years ago, maybe it started hurting. They tried injections of cortisone. They tried an operation to cut the nerves. Nothing worked. And I've been in pain constantly.
How does it feel to feel the pain relief within the first treatment?
Like magic. But my son said he had the same thing.
So you came prepared.
Immediately he felt better, and I was always careful not to move to cause the pain. Now I don't have to. It'll take me a while, but I can do anything.
Would you recommend ANF therapy to your family and friends?
Oh, my friends in America can't wait to hear. We told them on the phone, and our friend said, "I need to know if it's here." She has a lot of pain problems, and she can't wait to hear about this. Yes, we're going to tell everyone. Any of my friends at my age range, which is 40 something, of course we're going to tell them about it, because you don't have to take medicine, you don't have to take drugs, and it really, if it helps this quickly, and I follow your recommendations to stay hydrated and to replace them, I'm looking forward to a whole different life.
Thank you so much.
Oh, you're more than welcome.